Thank you for choosing Axxess On Demand. We're the fastest growing home health technology company, helping improve care for more than 1.5 million patients and trusted by more than 7,000 healthcare organizations to grow their business. Axxess is a firm believer in continuing training, and we create content so you can learn and grow anywhere, anytime. Let's get started.
One of the components of running a successful business is understanding how to market your services. Who do you contact when you want to market people? How do you present your services? So I want to thank Axxess for this opportunity to educate the industry, and we'll talk today specifically about some of a niche market focus and other focuses in terms of marketing your home health agency. The key behind today's presentation is focusing, is really learning how do you focus on what you do best and how do you present that as a marketing component so that you are communicating that with your constituents. My name is Merrily Orsini, and I have been in the home care industry for 36 years. Most of my time has been spent in the private pay area, but for the last 18 years I've been working with a variety of agencies, home health and hospice, and other aging care service providers in addition to private pay, and also have been working very heavily in digital marketing. So I have a keen understanding of the industry and how one should go to market while providing services within this industry. So when we're talking about the future of healthcare at home, we really need to think about the changes that are happening in the industry today. And this is really geared toward the smaller home health agencies, the agencies that really do need to pay attention to marketing because they haven't really had to in the past. So that is what we're going to focus on in this three-part series. And hopefully you will find some ways that you can change what you're doing or look forward to the future so that you will be successful and thrive as we enter this changing environment and as we live through this changing environment of home health care. So this is a three-part series, and in this first part what we're really going to talk about is creative ways to approach the services that you're currently offering and how you message those. In the second part we'll talk about how you actually approach people that will be new people that you're going to be selling your services to, and then in the third part we'll talk about some specific tactics that you can use to go to market to sell your home health services. Now again, I'm targeting this to the Medicare home health agency. So traditionally, you have had a very narrow focus on who you sell to. We've also had a pretty standard way that you sell. Because Medicare home health is a post-acute service, there are providers in this industry that are natural referrers, and that is where most people have spent their time. And it's been very successful for everyone because you have the healthcare continuum and you just work within that system and find referrers that will refer to you. You know if someone goes into a hospital, there's a chance that they are going to need some home health care if they come out of that hospital. The same with the SNF. So you really are rehab. Oftentimes people will have a need. They'll still be homebound even when they're discharged from a facility, but that's been how the referrals have traditionally been made in home health. Now, things are changing, and in your state they probably already have changed, and if they haven't, they are going to change pretty soon. But there's all different types of reimbursements that are now happening within home health. We have managed care, we have the accountable care organizations, we have bundle payment entities. All types of people are looking for partners and looking for ways to provide the services from a different reimbursement model. This is just some of the examples of the changing reimbursement models that we are currently having in the industry. We talked about ACOs, we talked about partners for bundled payments. Managed care is, if it's not already in your state, is coming quickly to all of the states because it is a way to help keep a cap on cost and also to have an extra layer of supervision and management over the care that is provided. There's all kinds of healthcare at home options now through insurance reimbursement, and those are only expanding. As America ages and as there's more of a need for home care, there will be more ways for people to pay for home care. There's also chronic care insurance, long-term care insurance, some other areas that have never affected home health agencies in the past, but in the future this may change. And then value-based purchasing. everyone is going to be in more of a value-based purchasing model in the next few years. So if you're not already looking at how to do that, you really do need to look at how to do that, and value-based purchasing generally means that you need partners. So thus we get into what you need to do to focus. And I'm going to present two options to you today. And they're really options that are on different parts of the spectrum, but they're not mutually exclusive. And that first one is to find a niche service that your agency provides, something you're very, very good at. And that is one way to go to market in this new environment. I'll explain more about that in just a minute. The second is to expand your thought processes, to be more of a healthcare navigator, to be more of a care manager, not managing the care, but understanding all of the components in the industry that come together to help pay for services. One of the things that we really don't talk about in this industry is that care is a continuum, and what Medicare Certified Home Health reimburses is a very small segment of the needs and of the population. Most people, when they need care, are shocked to find out that they can't get everything they need reimbursed by Medicare. So expanding your thought processes into how you can find more ways to reimburse for their care is another way to go to market. And let me do a caveat here, because whether you pick the niche market or whether you pick an expanded model where you're understanding how to really navigate the system, you still need to verify everything you do with data, because everyone's out there saying we have the best staff, we have the lower readmission rate, lowest readmission rates. So what you need to do is be able to verify what you are stating with data, and you need to present that as well, because people are not going to be swayed anymore simply by what you say. You're going to have to be able to prove it. So let's deal with the niche market first. You're probably asking yourself right now, how do I do this? How do I create a niche service? Because, most home health agencies offer the same services. It's based on what you're going to be reimbursed to provide, and so everyone has the same list of services that they can provide. So how do you go about deciding which one of these services you could actually excel in, that you could call a niche service for your agency? So we're going to talk about distinguishing yourself, and you really start by doing an internal audit. What are you good at? Is there something that you're doing that you're especially good at? Do you have nurses that are certified in wound care? Are you really good at taking care of these high acuity patients, getting them out of the hospital, making sure they're not readmitted, maintaining all of their services at home so that they can stay at home and benefit from home care, not go back into the hospital? Do you have nurses on staff who are really good at IV? So really look inside your agency to determine what it is that you're already doing that could be determined as a niche service. Do you service a pediatric population, or do you service a geriatric population? Or are you somewhere in between? So what types of services are you currently presenting that are going to lend themselves to creating more of messaging around that and a more focus, so that you can say that you do provide a niche service? And if you're not, what are your capacities? Can you take on more intensive patients that need more intensive care? Do you have staff to do that? Can you scale in that niche? Because those are the two important things. Can you staff it and can you scale it? Because that's what someone's going to be looking for. If you're going to say you provide a service, you're going to have to be able to expand that service and provide it in more areas to more people. Can you do a better job at scheduling visits? Can you group your visits geographically so that you are saving time and money in scheduling, or focus on a particular area so that you can work with people that are providing services in that geographic area? So you really have to look at your current data and see if you have enough of any type of a service, any type of a geographic area, any type of a specialty that you can actually build into a niche service that you can go out to market. The other important thing to look at is what's your competition doing. If everybody in your market is doing wound care, then that's not going to be a good choice for you. You're going to have to look for something else. So it really does take a serious look at your data and then some analysis to see what it is you're providing that you could then come forward in terms of specializing, which is really what a niche market is just a specialty. The other thing is languages. Do you have a specific ethnic group that you deal with, or do you have a group of nurses who are in a specific ethnic group? That will also allow you to have a niche market capacity because of the language barrier. You will be able, if you've got a specific language that you have nurses who are proficient in, that's another way to come up with a niche market. Creating a niche market service doesn't mean that you're not going to do everything that you're already doing, because you already have a home health agency and you're already providing a full range of services. What you're trying to accomplish is becoming top of mind. And top of mind is a marketing term, which really means when someone thinks about ordering home health services, who's going to come up on top of mind first? And that's going to be you, if you've created a way to make you be top of mind. And the best example that I have of this is Jewish Hospital in Louisville, the first hospital in the world to do a heart transplant, and became known worldwide for heart transplants and for heart care. So Jewish Hospital, if you needed heart care, that's where you went, and everyone knew that, and that was clearly top of mind for many years. Well, some of the other hospitals put together a survey to see, again, I said, look at your competition and see what they're doing. So they did a survey to see what other services could they excel in, because Jewish Hospital was winning so much in this heart area. So one of the questions on the survey was obstetrics. I wanted to know which hospital in Louisville, Kentucky had the best obstetric unit. Well, guess who won? Jewish Hospital. And guess what? Jewish Hospital never has and still does not have an obstetric ward. So they've never delivered babies in Jewish Hospital. But the fact is that they had done such a great job of marketing themselves as a heart hospital that everyone thought if they're good at that, they must be good at everything else. So just an example of how that can happen. So what you're really trying to do when you create a niche market service is become known for something and doing something really, really well. And it's that being known for doing something really well that will help you get top of mind with your referral sources. So I said there were two models, and it's just the opposite is another model, but again, they're not mutually exclusive. You can have a niche market service, and you can also provide care navigation services. So what you really want to do in this care navigation component, and it requires a broader understanding of all of the entities that play in the healthcare at home field. So what it means is you're going to have a patient who is assigned to you, who has to be homebound, who has to meet Medicare eligibility requirements, but that patient may have other needs. And if you can meet some of those other needs, refer some of those out, but meet some of those other needs, the goal is to have some continuum of care activity with this patient. So in order to do that, you may have to provide services outside of your Medicare home health certification. You may have to look at the possibility of providing some waiver service programs. You might have to look at reimbursement from other sources like the Veterans Administration. Sometimes there are local sources that will actually pay for care, and you may have to look at those. There's also DME, medical equipment that needs to be delivered in the home, possibly maybe home modifications, maybe Meals on Wheels. There's lots of different community services that will allow a patient to remain at home that can be used in tandem with home health services. So this is really not a traditional role that home health has played, but around the country I am seeing that those agencies that take this broader look, more of a look at what are the social needs of the patient in addition to what are the medical needs and how can I meet those needs, then stay within my Medicare regulations but also bring in other services, then that's another way for you to excel in this new changing home health environment. And that requires being involved in the community and being involved in the healthcare delivery system in the community. So it really is a different focus, a different look, an expanded way to look at the services that you are providing. But again, what we're trying to do is have you be top of mind. So if you're helpful to someone and that family is appreciative of your help, they're also going to tell people, and your referral sources are also going to tell people. You will make a name for yourself by being different in this home health market. So, what exactly does it take in order to accomplish what I'm talking about? Well, first you have to look at your capacity, your internal capacity, and make certain that you are staffed adequately and that you have someone in the business who can actually be that community liaison. In home health, we call the people who go out and try to sell the service marketers or community liaisons, and I'm talking about a different role for this person. I'm talking about someone who has the capacity to go up market, which is really looking at who do you have to get in front of in order to present your services in a different way. You really need to drop back and strategically plan the things I've talked about. You have to research. Again, we talked about the competition earlier, but you need to research the other options in the community. You have to be involved in the community. You have to have staff that's available for networking opportunities, and then you also have to communicate all this. So that means having a marketing communications component to your agency that allows you to talk about the things you're doing and allows you to be able to effectively present those to the people that you need to get in front of. And then obviously capacity to implement what it is you're trying to do. So it's a different model for home health than we've had before from our traditional sales model. So it really is going to require you thinking about it in a different way. Now, I'm bringing in the C-suite psychology here because, go back to the slide we talked about, the different reimbursement models. If you are needing to be reimbursed by a different model in order to stay in business and grow, then you're going to have to think about the target that you're going to reach, and that's going to be the C-suite executive in some of these situations. Not all of them, but in some of them you are going to have to go up market and have the capacity to be able to present and talk to someone who is at a different level than you've normally had to talk to. You've normally been dealing with discharge planners or admissions nurses in rehab facilities or nursing homes who are discharging people. So the psychology behind the C-suite executive is different than the target that you've had in the past. And what are they looking for? They're actually looking to expand their service base. They're looking for someone who can partner with them, someone who has a quality service. And that goes back to my comments about no matter what you're doing, you're going to have to prove that you're doing it really well. So a quality service. No one's going to want to bring in a partner who is not the same or better quality than the services that they're offering. They're also going to want to look at your capacity to be able to scale in whatever thing that they're bringing to you or whatever service they're agreeing that you can provide in this partnership, and they're going to look for innovation. In this time of change, you're going to have to be innovative in your approach. So part of this innovation is looking at your niche market services or looking at your capacity to serve more as a care navigator and provide more services. But innovation is something that they're also going to be looking at. Are you using any type of telehealth or using any kind of operational systems that make you be a more efficient operation? So that C-suite executive is going to really be looking at you as a partner to make certain that you can deliver what they would like to have in their partnership. Now, this is the caveat. Don't forget, you still have to do everything else. So what I'm talking about is preparing for the future, thinking about how you can position yourself so that you will differentiate yourself in the market and position yourself so that you are a prime candidate for partnering with a larger entity. But you still have to do everything that you've normally been doing. You still have to do your high performance measurements and indicators. You still have to be performing and be providing a quality service and showcase that. And you really do have to do all the other things that you've been doing. Integrate with others in the healthcare delivery system, have systems in place for chronic disease management, provide relationship-based care, all of the kinds of things that you normally do in your daily home health agency activities, you are still going to have to do. So this is just another thing to add in and to think about. And again, we're thinking about the future. So the next steps to success, what are those? Well, number one, you have to stand out. So we've talked about standing out, either selecting a niche service or going the broader range of where you are actually adding values to the services that you're providing by layering some services with coordination. You have to showcase results, positive results, so that your target is going to pay attention to you and know that you're not just talking, you actually can back up what you're stating that you do with hard data and facts. Innovation, we've talked about that. Find out what you're best for doing and go for it and look for creative ways to do it, and then that ability to scale. A realistic approach to what you're doing, and can you actually scale that service? I want to thank you for your time today, and here's contact information if you want to reach me. There's lots of ways to do it. I'm pretty available, and I want to thank Axxess for the opportunity to help educate the industry as we move forward in providing services for the best industry in the world, healthcare at home.
Thank you for joining our on-demand training today and for choosing Axxess, a provider of innovative, cloud-based software, services, and solutions to help home health organizations improve patient care and grow their business. Axxess is the only healthcare technology company approved to award continuing education credits by the American Nurses Credentialing Center, and is also the most recommended home health software on Software Advice. You can watch more on-demand training videos through our software or at axxess.com, where you can also find tutorials, blogs, white papers, and answers to frequently asked questions. Thanks again for choosing Axxess.